After about 4 years of eating a lot better, because I was basically on the Atkins diet, which is very good for blood sugar, which turns out to be good for most people's mental health issues as well. I had my second pregnancy, and that went okay. And then after the second pregnancy, the first thing happened, the same thing happened as after the first pregnancy, which was I just had this total collapse of my immune system. I got a new cold every 4 weeks, completely depleted. I just was not springing back from a completely normal pregnancy and healthy delivery. And so I ended up researching more, what am I supposed to do when there's no solutions in the medical community? And I'm still in the library with my fanny on the floor because there's no research tools like the internet. And so I got involved with Dr. Atkins' organization called the Foundation for the Advancement of Innovative Medicine, and eventually served on their board of directors, and piece by piece gathered more and more information about my situation. But I'm still not finding out what is at the root of what's going on. So I'm limping along, my life is okay. I still have a fair amount of energy because now at this point I'm eating really well. And then I get into my late 40s and the whole thing comes back again. And this time the joint pain was so debilitating that I couldn't conceal anymore. I was hobbling. When it got to the point where I couldn't walk without hobbling, I said, ugh, God, I got to become a patient again. I was just feeling so relieved that I was beginning to feel like a person instead of a patient. No. I'm going to become a patient again. So this time, a girlfriend who works with the children and families with autism said, you have a lot of the same problems that I see in our autistic families. I think you should go to XYZ doctor and see if you have heavy metal poisoning. So this time I was ready. And I went to get, it's called chelation therapy. At the time, it was totally vilified for anything but, I think it was lead poisoning. There were a few things for which chelation was approved, but it was a red flag. Your state medical authorities could go after you, or were signaled to investigate you if you were a doctor doing chelation therapy. And there were horror reports on the internet. But I found a person who was board certified in it. It's not board certified, had a meeting to me. So I went ahead and did it, and that was when we found out that I was absolutely, completely loaded with mercury. It all came from dental amalgam, and there is a smoking gun, and I have lots of lab work with it. I have several photographs of myself during chelation therapy with these hot, crispy, bleeding exit wound lesions all around my mouth. So there were no exit wounds anyplace else on my body, just around where the amalgam had been put in. And I should add that by that time, I already had, over the years, gotten rid of all of my amalgam, so it was either gold or porcelain in my mouth at this point. But all of the mercury amalgam had been removed without any kind of precautions. So the vapors were, as part of the removal process, the vapors were accumulating in me. What I didn't understand at the time was that some people are genetically predisposed to bioaccumulating heavy metals, and that has to do with various genes that either switch on or switch off your susceptibility to developing autoimmune disease because of how your body interacts with heavy metals. In my case, it's called MTHFR gene, and there are other things that predispose you genetically to bioaccumulating heavy metals. So now I have found my way to the one therapy that works. Over the course of the treatment, it was $30,000 out of pocket, which I am deeply grateful that I was able to pay. But the really peculiar thing was that everything that didn't work, including the psychiatric hospitalization, was reimbursable on my medical insurance. And the one thing that actually worked, we had to pay out of pocket because it wasn't the treatment of choice.